Bronchitis, signs and treatment. The swelling or inflammation of the bronchi, bronchial tubes, and all the passages of air is known as bronchitis. To be specific, bronchitis defines a state where the walls of the bronchi tubes get reddened and swollen. People suffering from bronchitis are not able to breathe freely so that oxygen can pass through their lungs, as well as not being able to forcibly remove phlegm or mucus from their air passages. This editorial will explain what causes bronchitis, signs, cure, and how to prevent you from getting bronchitis. What are the truths about bronchitis? These are some of main details concerning bronchitis. Particles that inflame bronchial tubes, bacteria and viruses are what causes bronchitis. Severe bronchitis is a temporary illness that comes after a virus infection or a cold. Critical bronchitis is an enduring disease that is caused by prolonged illness or environmental conditions. Smoking of cigarettes is usually the main cause of critical bronchitis. So as to diagnose bronchitis, perform blood test the functioning on your lung, and take an X-ray for your chest. Symptoms and signs of both severe and critical bronchitis: continuous coughs accompanied by mucus, shallow breathing, wheezes, chills and little fever, tightening of the chest, coarse throat, body pains, difficulty breathing, headaches, sinuses and blocked nose. The main sign of severe bronchitis is prolonged cough that can go for a number of weeks. It may even continue for many months in cases where the bronchi take longer to completely heal. It is a fact that the signs of critical bronchitis often become terrible twice or more times each year, and it gets even worse over the winter periods. Although, a cough that takes so long to disappear could be a symptom of other diseases like pneumonia or asthma. Bronchitis may be severe or critical. Severe bronchitis. Severe bronchitis is a temporary disease that comes after a virus infection or a cold, for example after flu. It is usually associated with fever, soreness, discomfort in the chest, coughs accompanied with mucus and breathlessness. Severe bronchitis normally takes a number of days or weeks. Critical bronchitis. This is a grave prolonged disease associated with stubborn coughs along with mucus, and may continue for up to 3 months in a year for 2 years or more. Persons suffering from critical bronchitis may experience difficulties breathing, and the signs could sometimes improve and suddenly turn for the worse at varying times of the year. When critical bronchitis is accompanied with emphysema, it results in COPD, chronic obstructive pulmonary disease. Bronchitis treatment. Bronchitis patients are normally advised to get enough rest, take fluids, breath in moist and warm air, take suppressants for cough such as OTC, swallow painkillers to control signs and enhance breathing. It's worth noting that severe bronchitis may disappear without any medication. However, critical bronchitis doesn't have treatment. So as to manage symptoms and signs of bronchitis as well as provide relief for the patient, doctors may prescribe cough suppressants. It is worth noting that coughs need not be suppressed completely, as it is the only way in which irritants and mucus is eliminated from the patient's lungs. There exists a wonderful online selection containing hundreds of reviews from satisfied customers, which can help you choose the best cough suppressants. To clean out mucus and open bronchial tubes, use bronchodilators to enhance elimination of phlegm and sputum from the air passages by loosening and thinning mucus. Use mucolytic. If you got critical inflammation that is likely to damage your tissues because of continuous symptoms, use glucocorticoids and anti-inflammatory medicines. Perform oxygen-related therapy to enhance intake of oxygen and manage difficult breathing. Perform respiratory activities under observation of a therapist, respiratory, to help enhance breathing, a program called pulmonary rehabilitation. Use antibiotics. They are usually very active for microbial infections, but are not indicated for infections caused by viruses. However, antibiotics could help combat subordinate infections. Further behavior-related remedies for bronchitis. Eliminate the cause of lung irritation such as quitting smoking. For the purpose of loosening mucus, reducing wheezing and permit limited flow or air, use humidifier. Practice as it will activate and make breathing muscles stronger. Perform exercises that enhance breathing such as lip pursed breathing, which is good for slowing breathing down. What causes bronchitis? Bacteria, viruses and additional particles that irritate the bronchi making it inflamed are the main cause of bronchitis. What causes severe bronchitis? Severe bronchitis is mainly caused by the same kind of viruses that are responsible for causing flu and colds. Severe bronchitis is also caused by exposure to lung irritant substances like pollution from air, vapors, fumes, dust, and smoke from tobacco and infections by bacteria. What causes critical bronchitis? Critical bronchitis is usually caused as a result of the lungs being repeatedly exposed to irritants that destroy the tissues within the air passages. The major cause of critical bronchitis is smoking, but it may also be caused by overly exposing one's lungs to environmental fumes, dust, and polluted air. Similarly, repeated critical bronchitis episodes may also cause it. Diagnosing bronchitis. The physician will question the patient concerning the symptoms they are experiencing and find out if they are coughing. During the examination, the doctor may want to know about the health history of the patient, if the patient has suffered from a flu or cold in the recent past, if the patient is a smoker, or if the patient has been exposed to irritants such as polluted air, vapors, fumes and dust. The physician uses stethoscope to find out if the patient's lungs is producing abnormal noise. Additionally, the doctor may evaluate the mucus and also examine the levels of oxygen concentration in the blood, as well as advise the patient to have an X-ray taken, blood test or lung function pulmonary test. Bronchitis-related complications. Pneumonia is the major bronchitis-related complication, and it results when the lung of the patient is deeply infected by the infection. The infection makes the alveoli, sacs of air in the lungs, to fill up with liquid. It is estimated that for bronchitis 5% of it end in pneumonia. Patients who have other organ diseases, those with compromised immunity, smokers, and those who are advanced in age are more likely to develop pneumonia if they have bronchitis. When should you visit a doctor? Although many bronchitis cases can be managed and treated from home through resting, taking of lots of liquids, and medicines that control inflammation, some instances require seeking a doctor's advice. When you are experiencing the following symptoms, please see a doctor as soon as possible: coughs lasting for 3 weeks or more. Endless fever going for more than 3 days, had a heart or lung problem before. Pains in the chest and faster breathing, blood-stained mucus in the cough sputum. Getting confused or drowsy. Recurring bronchitis. Viewpoint. Severe bronchitis is a very usual problem. In many cases it could be very uncomfortable, but is most likely to disappear just like that. If you see no changes of improvement or symptoms of its intensity going down, or you notice the signs discussed in this article, it will be better if you quickly find your way to a doctor to get medicines. How to prevent bronchitis. It is almost impossible to completely prevent severe or critical bronchitis. There exists many things you can do to mitigate the risks. Don't engage in smoking if you aren't a smoker, or stop smoking if you do. Keep off irritations for the lungs, e.g. polluted air, vapors, fumes, dust and smoke. If you can't keep off exposure, take precautions such as using mouth and nose masks. Maintain cleanliness by keeping your hands clean through washing to control bacteria and germs. Vaccination. Ensure you are vaccinated annually against flu. Vaccinate against pneumonia. A research conducted in Lebanon established that 89% risk increased due to passive smoking, hence doubling critical bronchitis infection risk, and home passive smokers was linked to 2.5 times critical bronchitis risk. It was also established that those who resided very close to the busy highways has the risk doubled, likewise to those that heat their homes with conditioners with hot air instead of heating with electricity. 62% risk of critical bronchitis is associated to living near a power plant using diesel to burn.